Hey guys, this is Chris Dewey with May River Medicare, and today we're going to talk about, I'm just going to educate you on how to find the best drug plan, the Medicare Part D drug plan, how to find the best one. And we're going to do that by using Medicare's Plan Finder. Okay, there's really only two ways that you can make sure 100% sure, well actually three ways. There's really only three ways to get this right 100% every year. One is to call 1-800-MEDICARE. They're amazing there, and usually if you call after 8 o'clock at night, they pick right up, and you can just tell them over the phone, you can tell them what your prescriptions are, milligrams. Just make sure you got your medication list. Call 1-800-MEDICARE. They'll actually enroll you over the phone in the ideal drug plan that is, they're going to find the drug plan that's going to have the lowest premium and the lowest annual drug costs, how much out of pocket it is for you. So the other thing we can do is we can go to medicare.gov, and that's what we're going to do today. It's real simple. You guys can just sign up by yourselves on the medicare.gov website. And what you can do is you can type in your prescription drugs, milligrams, and the computer is going to tell you how much a year you're going to spend, how much a year in premium, and how much in cost to you for co-insurance and co-pays for the prescription drugs. So let's go now. Let's go to www.medicare.gov, and then we're going to go to Plan Finder. So here we are at medicare.gov. And if you don't know how to get there, just at the very top of your bar, your URL bar, you're just going to type in medicare.gov. Okay, and then if you go down to Find Plans, you're going to click Find Plans. Now, if I were you, where it says Find a Medicare plan, I would just continue without logging in. Otherwise, you have to create an account. Give them lots of good information. It might take a while. So here we are. We logged in without getting an account. What types of 2021 coverage are you looking for? So we are looking for today's purposes a drug plan, a Part D drug plan. If you're 65 and over and you're on Medicare, and most likely you have a supplement to pay what Medicare doesn't, you're going to get a standalone drug plan to stand alone to go with your Medicare and your Medicare supplement. Okay, don't pay attention to the Medicare Advantage. So I'm not going to go into the Medicare Advantage plan. For you guys new to Medicare or folks maybe they're on it, let me just explain quick. So with Medicare Advantage plan, they are bundled. So bundles all Medicare health benefits into one plan. And so a Medicare Advantage plan with drug coverage, and they have extra services like dental, you've heard Joe Namath commercials, hearing, vision, etc. But the thing I don't like about the Part D plan, which is bundled into the Medicare Advantage plan, is you have absolutely no say in what kind of drug plan it is. The insurance company gives you a plain vanilla drug plan. They bundle it into the zero premium Advantage plan, and you're stuck with that. So we're going to look for an actual standalone Part D drug plan, because we're going to be able to basically custom make. We can find the right drug plan based on the drugs that we take. We're not going to take chances and get a Medicare Advantage plan with just a little drug formulary built into the Advantage plan. And there's a reason why it's a zero premium plan, folks. Usually the formularies that are built into the Part C Advantage plans are not that great. So with Part D, we get to choose what kind of coverage we get. All right. So let's just say we're in Bluffton, because I am in Bluffton, right in Old Town Bluffton. It's okay. So all right, so we type it in, and it recognizes Beaufort, South Carolina. Next question is, do you get help with your costs from one of these programs? So guys, we're just going to put, I don't get help. Most folks over 65 don't get extra help. All right, so next, we hit next. I don't get help. All right, so I just typed lisinopril in there. So this is where you decide to add your drug. So we add a drug. Let's put simvastatin. That's one that everybody takes. Well, a lot of people take. Very rare that I don't see someone on a statin. Okay, let's see here. So let's just say 40. It's not going to matter. 30, let's just go with 90-day supplies, because usually people do 90-day supplies for, maintenance drugs. All right, guys, let's let the plan finder run it with just these two plain vanilla generics. So we're done adding the drugs. So what the medicare.gov gives you up to 5 pharmacies, just to make it easy. Obviously, they're mail order. So with mail order, you can get a lot of your prescriptions for little or free or zero, won't cost you anything. So that's through the mail order, through the insurance company like Humana. The Humana, Walmart plan, and a lot of other plans that Humana has, the Part D plans. They have it where your generics and your preferred generics will be mailed to you every 90 days for free. You got to use that mail order system. Sometimes it's better to use the mail order. Sometimes it's actually cheaper to use the retail pharmacy. So let's do mail order, and let's do Walmart. A lot of people go to Walmart. Let's do Publix. I shop at Publix. I love it. The people are great there. And let's try this. I'm not familiar with them. Ulmer Family Pharmacy and Health, because I just want to show you. We want to make sure the pharmacies are in network. If they're not in network, you can pay a lot more for your drugs. I mean, a lot more. All right, so here we go. So who comes in first place? Now, before we compare plans, what you want to do you see right here where it says sort plans by? So what you want to do is, I always have it at lowest drug cost plus premium cost. So basically they're going to look at the premium, and they're going to look at what your share is as far as your co-insurance and your co-pays for the drugs. Because, they're not free. You have to pay co-pay, co-insurance, and the insurance company pays most of it, but you got to pay some. So no point in looking at the drug deductible. Don't use that. Don't use the lowest premium. The worst mistake people make with these drug plans. Oh, I got a low premium. That means nothing. If the plan doesn't cover your drugs, you're up the creek without a paddle. So lowest drug and premium cost. All right. So with those two drugs, let's take a look. We got Silver Scripts, Smart RX. Ooh, $7.30. Okay. So it says that the whole year, those two drugs, if you go to the either the retail pharmacy or mail order, it's going to cost you $21 for a year's supply of simvastatin as well as lisinopril. So let's click on plan details. Or better yet, let's compare this one. So guys, this is important. Your yearly annual drug cost. Okay, $21 a year. All right, so it's great. Now, here's the great thing. You see this drug deductible? Normally, the drug deductible is the amount you pay for drugs before your plan even starts to pay for anything, okay? But here's the thing. The $450 does not apply to generic drugs, all right? And those are generic drugs. So let me just give you an example. So here's the premium, $730. It says covers both drugs, 2 of 2. There's the monthly premium. The amount you must pay before your plan is the deductible, $445. All right, and so now let's look at the pharmacies. See where it says CVS Pharmacy? Preferred in network. Guys, you want a preferred in network pharmacy. Now, Ulmer Family Pharmacy and Wellness Center, it's in network, but it's standard. All right, it's standard. Same with Walmart, standard. Publix is preferred. You want the preferred in network, not the standard in network. Now, some of these smaller pharmacies offer a little bit more service, a little bit more, I guess, what's the word? You might have been using them for your whole life and you like them, and a lot of times they may be able to match prices with the preferred in network pharmacies. They want your business, they're smaller, and there's something to say for, small town, hometown hospitality. So I don't know. It's up to you guys, but let's look at the prices. So lisinopril, CVS, $0. I'd go to CVS. Simvastatin, $0. So those drugs are free. Ooh, yeah. So Ulmer Pharmacy, $57. Lisinopril, $57 for simvastatin. Public, $0. So guys, you want to stay in network. If you go to Walmart, you're going to pay $57 for lisinopril. You're better off just using a Good RX card. That's a video for a different day, but you can get a Good RX card for free and get it for a lot less than $57. So what do we learn from today? We learned that you only want to use a preferred in-network pharmacy. Standard in-network, it's like it's not really even in-network. You got to pay a lot of money for those generics, all right? Mail order, they're going to send you those drugs for free, 90-day supplies for free. All right, now real quick, let's just do something kind of different, all right? Let's say that I have asthma. I'm in great shape. I jog, I run, but boy, I've got one drug called Symbicort. Symbicort I take twice a day. And it's great. It's a lifesaver. But check this out. So now a generic is available. So with Symbicort, I've tried the generic. Unfortunately, and the funny thing is the generic price and the brand name it's virtually the same exact thing. So we're going to add the brand name. We're going to add the brand name because the Symbicort generic is, I don't want to go into it, but trust me, it's not as good and it's almost the same price. All right, so we're going to add that. And the last drug we're going to add is let's pretend you have insulin. You're on Humalog. So a Humalog has a lower cost generic called insulin Lispro. So it's just generic insulin. Folks, most of my diabetics are like, I need the Humalog, I need the Novolog, whatever the brand name is. But just for blanks and giggles, let's just do a generic. All right, there we go. Here's our drug list for if we were on insulin, simvastatin, and Symbicort. All right, so we're done adding the drugs, and we're done choosing the pharmacies. So now a much different situation. Okay, guys, so we typed in our drugs, and then what we did was we looked to see which drug plans popped up the best. So AARP Medicare Preferred standalone drug plan comes in at number 1. It's got a pretty high premium, $95 a month, but that should be the last thing that you look at, because the deal is this. For one whole year worth of drugs, 2 of which are brand names, the Symbicort and the insulin, it's only going to cost you $511 a year if you use the mail order, $553 if you use the retail pharmacy. That's preferred retail pharmacy, all right? So we got to make sure that they're in the network. Well, let's move down to Blue Cross Blue Shield, $205 a month premium. But what you got to remember is if you add the premium and the cost of the drugs, you're looking over $700 compared to a little over $500. So if we keep going down, you'll see WellCare to $1,200, Silver Script $1,300, all the way down to Silver Script RX $1,300. So guys, real simple. It's a no-brainer. This AARP $95 a month is going to get you where you need to go. And what do I mean by that? Let's take a look at the plan details. So it's $95. Right here, all 4 drugs are covered. All right, they're covered under mail order and retail. So one of the things you want to look at is, where is it? Here it is. So drugs are based on tiers, okay? Okay, so let's take a look. So drugs are based on tiers. So let's take a look at the tiers. Lisinopril and simvastatin are tier 1, all right? Tier 1. So that means they're generics. They're preferred generics. They're very cheap. So if we look at tier 1, we know that if you go to a retail pharmacy, you're looking at $5 copay for those. Now, if you decided to get the mail order, preferred mail order, which for those kind of maintenance drugs, I would highly consider doing that. Look at this. Not only are preferred generics free, generics tier 2s are 0. All right, and that's for a 90-day supply, 3-month supply. All right, the Symbicort, that's going to be $120 for a 90-day supply. So that's a tier 3. That's going to be your only big cost. You're going to be paying about $40 a month for that Symbicort, okay, the copay. Now, let's take a look at simvastatin, the insulin, okay, the insulin. So what they're saying with the insulin is this. You'd pay $105 for a 3-month supply of insulin. The reason why, even though the premium is so high, what you got to remember is you're getting Symbicort and you're getting this insulin at the tier 3, and if you use the mail order, heck, you can get that Symbicort for $40 for a 1-month supply, and less for the lisinopril. All right, so I'm sorry, the insulin. So it's all broken down by tiers, and just to show you one more time, and what is this right here? So preferred, okay. So our drug costs, if you go to a preferred pharmacy in October, it's going to cost you $167. These things are not always completely accurate, because when you think about it, if you use the mail order, those are going to be $0. And the only other thing you're going to have a $40 copay for Symbicort. Accurate, because there is no drug deductible. So it says when you'll meet your deductible, you won't meet it because you don't have one. So actually, October, if you did the mail order, you get these 2 drugs for free, $0. And then you would get, if you did the mail order, you get Symbicort, a 3-month supply for $120, so that comes out to $40 a month. And then for a 3-month supply of insulin, you're looking at $105, so let's just say $35 a month. So you got $35. The only drugs you're going to pay with the mail order a month are $35 and $40. So your drug costs for this plan, co-pays are going to be about $75. Okay, guys, let's wrap this up. So what do? We punch the drugs into the medicare.gov plan finder. We look at the premium plus the drug costs. We find out which company has the lowest costs. So in summary, insulin, tier 3. Tier 3 are $45 copays per month. So it's important. A couple things you want to realize is which pharmacy that you go to dictates how much more you'll pay for a drug. Not only the pharmacy, but how you get your drugs. In this situation with mail order, check it out. So lisinopril, you can get 90-day supply for free. Simvastatin, you can get a 90-day supply for free. Symbicort, that's going to cost you $120 for a 90-day supply. So that's $40. And again, the insulin, tier 3 insulin, $105, so that's $35 a month. So basically all you have with this plan, it's worth paying the $95 a month premium because all your drugs are covered, and the most you'll pay for any of your drugs is a $45 copay, and those are for brand names. So in summary, if your total yearly drug premium plus, your total yearly drug costs, your share of the drugs, plus the premium, the best way to do it, guys, is mail order. $511, for the whole year versus $609 if you went to Ulmer. You don't need to do this stuff by yourself. What I would recommend you do, 8 o'clock at night, you're watching your favorite ball game or your movie or whatever, call 1-800-MEDICARE, talk to the people on the phone, give them your list of medications, and within minutes, they're going to tell you and enroll you in the best plan. Or call me, 843-227-6725. I mean, I don't really have routine, like business hours. I work all the time. I mean, if you call me at 9 o'clock, I'll probably pick up the phone and help you with whatever you need help with. So anyway, what I would recommend you do is click the checklist below. It's the 2021 annual enrollment checklist. That's that October 15th to December 7th, where you can make changes, and you want to make changes if you look at your annual notice of change on September 30th and you realize that 2 or 3 of your drugs moved up a tier. It used to be like $10 copay, now it's going to be $40 copay or $45 copay. That's why you need an agent, someone seasoned in this business, has been doing this for over a decade. They can very quickly educate and empower and enroll you the right way. So guys, October 15th is right around the corner. If you've made some prior mistakes, maybe you went into a plan and now you're realizing it's not that bed of roses that Joe Namath told you it was going to be. Maybe you're new to you're a couple months away from turning 65, or maybe you're 78 years old, you live out in Sea Pines and you've had the same plan since you were 65 and you've noticed your premiums are like double what they used to be. Give us a call at 843-227-6725. We're going to give you a free review. Our services cost nothing, and we are there for you when you need help, when the insurance company doesn't pay a claim or ask for a pre-authorization and you need some help. We're here. Our client services team is here for you. So you guys have a great day. I hope you had a great Labor Day, and we'll talk to you soon. Bye-bye.